Hi, my name is Paige and I'm a women's health nurse practitioner student, and I see that you have questions about the HPV vaccine. Well, today we will address all of your questions and give you a little bit more information that I think you need to know. First of all, Mom, I really want to commend you for being proactive in bringing in your daughter. The vaccine is typically recommended for preteen boys and girls at ages 11 and 12, but no worries. Your daughter will be able to get the vaccine today. She will get 2 doses, with the second dose being 6 months after the first dose. So just a little bit of information for you, or education. The word HPV is short for human papillomavirus. It is a virus passed from one person to another during skin-to-skin sexual contact, which includes vaginal, anal, or oral sex. The virus is most common in those in their late teens and early 20s. So you're probably wondering, why do we encourage parents to have their children get the vaccine while they're so young? Well, we want our children to have time to develop an immune response before they begin being sexually active. The immune response to this vaccine is just better in preteens. Also, we just want the child to be protected before they even start thinking about sex. It is most effective before exposure. We are in no way saying that the child is ready to be sexually active. According to the Centers for Disease Control and Prevention, HPV is a very common virus, and unfortunately, nearly 80 million people have already been infected with the virus, and about 14 million teens become infected each year. Most people with HPV have no symptoms, and sometimes the virus can go away on its own, but there are other times where the virus can cause genital warts and cancers of the cervix, vagina, vulva, anus, penis, and mouth and throat. But that is where the HPV vaccine comes in, and that is why I want to applaud you for what you've done. I know that you have had questions concerning the safety and effectiveness of the vaccine. When it comes to safety, all the vaccines that we provide here at the clinic go through extensive safety testing before they are licensed by the Food and Drug Administration. They're continually monitored for safety and effectiveness after they've been released on the market. Many research studies with the vaccine have been carried out, and no serious safety concerns were found. Both the CDC and the FDA reviewed the safety information made available to them for the HPV vaccine and determined that it was safe, and it still is safe. I do have to let you know, though, that there are some common mild side effects that can happen after the administration of the vaccine, and that's pain, redness, or swelling in the arm that the shot was given, fever, dizziness, and nausea, muscle or joint pain. Some teens and preteens might faint while getting this shot, or any shot for that matter. So we will have her sit down or lie down while getting the shot, and for about 15 minutes afterwards. Serious side effects have been found to be rare with this vaccine. I do want you to seek medical care if your daughter does exhibit signs of a severe allergic reaction. You'd want to call 911 or go to the nearest hospital. You want to look for signs or symptoms that concern you, such as hives, swelling of the face and throat, difficulty breathing, fast heartbeat, dizziness and weakness, very high fever, or behavioral changes. These would start about a few minutes to a few hours after the shot is given. Again, I must remind you that severe reactions such as this are rare and happen in about 1 in a million vaccines. So as for effectiveness of the vaccine, the HPV vaccine works extremely well. In the 4 years after the vaccine was recommended in 2006, the amount of HPV infections in teen girls decreased by 71%. HPV causes over 32,000 cases of cancer in men and women every year in the US. HPV vaccination can prevent over 90%, or 30,000 of these cancers, from ever developing. So the vaccine is awesome. It's amazing. The vaccine does provide a long-lasting protection. Data suggests that the protection provided by the vaccine can continue beyond 10 years. 10 years. Research has also shown that fewer teens are getting genital warts since HPV vaccines have been in use. Do you have any other questions for me that I can address for you? If not, if you're still interested, let's get started.